Kscien is committed to embedding and improving research culture in developing countries. We value the works of committed researchers who are new in the field and emphasize the importance of their craft. Kscien, Organization for Scientific Research. Kscien, a nonprofit organization, aims to advance and enhance scientific research globally, especially in developing countries. Kscien conducts various scientific events, such as workshops, symposiums, courses, and conferences, to support researchers, particularly in developing countries. Our vision: the highest academic establishment for developing scientific research and confronting fraudulent and predatory journals in developing countries. Our mission: Kscien is committed to embedding and improving research culture in developing countries. We value the works of committed researchers who are new in the field and emphasize the importance of their craft. Kscien, Organization for Scientific Research. Kscien, a nonprofit organization, aims to advance and enhance scientific research, especially in developing nations. Kscien conducts various scientific events, such as workshops, symposiums, courses, and conferences, to support researchers, particularly in developing countries. Our vision: the highest academic establishment for developing scientific research and confronting fraudulent and predatory journals in developing countries. Our mission: Kscien is committed to embedding and improving research culture in developing countries. We value the works of committed researchers who are new in the field and emphasize the importance of their craft. Kscien, Organization for Scientific Research. Kscien, a nonprofit organization, aims to advance and enhance scientific research globally, especially in developing nations. Kscien conducts various scientific events, such as workshops, symposiums, courses, and conferences, to support researchers, particularly in developing countries. Our vision: the highest academic establishment for developing scientific research and confronting fraudulent and predatory journals in developing countries. Our mission: Kscien is committed to embedding and improving research culture in developing countries. We value the works of committed researchers who are new in the field and emphasize the importance of their craft. Kscien, Organization for Scientific Research. Kscien, a nonprofit organization, aims to advance and enhance scientific research globally, especially in developing nations. Kscien conducts various scientific events, such as workshops, symposiums, courses, and conferences, to support researchers, particularly in developing countries. Our vision: the highest academic establishment for developing scientific research and confronting fraudulent and predatory journals in developing countries. Our mission: Kscien is committed to embedding and improving research culture in developing countries. We value the works of committed researchers who are new in the field and emphasize the importance of their craft.
Hello. Hello. Do you hear me?
Hello, dear Professor. Do you hear me?
Yes, I do.
Hello, how are you doing?
I'm fine. And you?
Thank you so much. I'm fine too. Hello, everybody, and welcome to another episode of Kscien Spotlight. Gladly, today we have Professor Driss Moussaoui from Morocco. He's a very experienced researcher. He published more than 200 papers and chapters. Already we shared his CV with you, so we don't repeat all the information. But most importantly, he's author of a textbook called Oxford Textbook of Social Psychiatry. We are very glad to have Professor Moussaoui from Morocco talking about the economic aspect and economic issues of research, how we can, from developing countries, overcome the issues of fee and economic problems of conducting research, application research. So, dear Professor, welcome again, and thank you for your valuable time. The mic is yours. We are hearing. If you have a slide, we are very glad to see it. Do you have a slide, or you just talk to us?
Yes, I do. Yes, I do. And what I'm going to do now is to share. Takes some time to share the slides with you.
No, but just try another time, please. No, we don't see the slides.
Okay. It is here. Do you see it?
Yes, just uploading. Yes, that's good. Just can you just slideshow, please? Okay, very nice. We see all of it. Yes.
Okay. So thank you for the invitation. I chose this title because about 30 years ago, I was invited in Damascus by the Board of Arab Psychiatry that made possible for people who graduated from various parts of Arab-speaking countries to be recognized for their diploma in different Arab-speaking countries, in the other Arab-speaking countries. And we had a dinner, and I had two professors of psychiatry from Syria on the same table. I asked, what about research? And the only answer I received was, we have no money for that. It was a surprise to me because, just to tell you, I mean, a little bit in advance, that during my 35 years as chairman of the Ibn Rushd University Psychiatric Center in Casablanca, Morocco, I was the founder and chairman for 35 years. 95% of all research studies conducted there, in my department, were without financing at all. At all. So, and first of all, I would like to stress the extreme importance of research for all countries. And I remember a prime minister of France in 1976, Raymond Barre, who was an economist, very distinguished economist, who said this: when a country is in a difficult situation, economical crisis, it should invest much more in research, because this will open doors for solutions to about the problems of the country. So research is a necessity in all countries, because otherwise we are like blind people trying to find a well, water in the desert. It's impossible. I mean, if you don't have hypotheses, if you don't try them to see what's right and what's wrong, then you're lost. The most important thing in research is good thinking, to ask the right question. And pseudoscience, of course, is destructive. And I remember in the 1970s in Paris, I had one of my teachers in social sciences who was an ethno-psychoanalyst, Georges Devreux, who used to teach in the US and in France, and who gave a terrible example of a research from every single point of view. Taking a sheep, amputating, just breaking the leg, one leg of the sheep, and giving some water to drink to the sheep. And his conclusion for the first leg was difficult to approach, to come near the water to drink. Then he broke the second leg, then the third, then the fourth. And when he broke all the four legs, the conclusion was the sheep is no more thirsty. This kind, it's a metaphor, of course. Stupid questions lead to stupid answers. And of course, destruction of science. We should not hesitate to do some Me Too research. Why not? If it is helpful to the country where we live. Of course. The best example is epidemiology. For example, epidemiology should be a major path in research for all countries. And we have seen that, for example, in the United States of America. ECA studies in the 70s, in the 80s, in the 90s, then the NCS, then the NCS replication, and so on and so forth. Every 10 years, they were looking at how many people suffer from mental disorders in the general population. That was very useful. And not many countries in the EMRO region have done the same. We have done one. Tunisia has done one. Maybe Iran did the same. But few countries did this kind of studies. Medical research, whenever possible, should tackle public health problems. And this reminds me of a historical fact. In Aleppo, in Halab, Syria, in 1906, there was a cholera epidemic. And Syria at that time was part of the Ottoman Empire. And the prime minister in Istanbul sent a big number of medical doctors. People were dying by hundreds. And they stayed there for 3 months in Halab. 3 months. And their conclusion was, this is the result of bad air in Halab, Aleppo. And therefore, we should build, this is cholera, diarrhea and vomiting and so on and so forth, and people died from dehydration. We should build very high walls around the city in order to bad air to come inside. This is a true historical fact. And in 1906, the bacteria that causes cholera was already found I think it was in Germany or something. It was discovered, and people knew already in Europe that it was coming from dirty hands and dirty water. This is to say that one has to know the best published research through medical press or congresses all the time, and it is progressing fast. Just to tell you, I'm a member of the French Academy of Medicine, and every Tuesday they organize a weekly meeting with 4, 5, 6 presentations. And I never miss one when I can. Never. I'm 75. And I learn things in medicine all the time. Please know that you know very little or almost nothing, including in psychiatry. So be curious. Be research oriented. And believe it or not, this will help you to live longer and in better health. If you are curious, if you have the eyes of a child discovering the world in novelties, you will stay alert and very much sharp. Good questions to ask. First, what are the good questions to ask to know about for my patients and about my patients? To know. You see, this is in red. To know. Of course, I mean, this knowledge will not be definitive. It will change in the future. When I was a medical student in the 60s, the gastric ulcus was due to hyperacidity of the stomach. And they were removing the stomach, all of it, almost, until they discovered it was a bacteria. And there is a very recent study conducted on Parkinson's disease in, I think, 10 different countries, showing that all people with Parkinson's disease had a kind of bacteria in their microbiota, and not the people who are not with Parkinson's disease. And maybe, I mean, this was published, I think, 10 days ago, 2 weeks ago. And maybe the same thing will happen with Parkinson's disease. That you give antibiotic and then you protect it from Parkinson's disease. So what you know now, the only certainty is that it will be obsolete, completely wrong in 20, 30 years from now. No, never stop learning. What is good to know for my patients, but also what is good to know for all patients of the world with this diagnosis, illness, condition, whatever, to help patients in other parts of the world. What is good to know for families of patients and for society. I mean, I will give you an example. We did a study in my department some years ago about bipolar patients in Ramadan fasting. And the first study was on, I think, 20 patients before, during, after. And we found about 40% of relapses in bipolar patients otherwise stabilized. And another study was conducted in Pakistan showing zero relapses in bipolar patients during Ramadan. So we made another study, I think it was 80 patients or something, and we found the same thing, 42% of relapses. I don't want to comment on that. When patients ask me with bipolar disorder, should I fast? I say, no, don't do that. And I give him the results of our two studies. One of them have been published in World Psychiatry, the best journal in the world. This concerns 1 to 2% of all Muslims in the world. So it's our patients, but also patients, Muslim patients all over the world, and not only in Islamic countries. Where to find good research ideas? Answer is everywhere. First, your patients are your teachers. They teach you a lot if you are enough humble to accept that. Families as well of patients teach you a lot, or teach us a lot. Good medical papers. Please have journal clubs in your hospital, in your university department, wherever you are, every week. 3, 4, 5 papers, and this will help you think what could be replicated, what could be done in order to shed some light on the obscure parts of that topic, including your publications. You think you have been extensive in the way you treated the topic, but this is not true. You have a lot of related issues to the topic that you didn't touch on. So dig as much as you can. Congresses, another place where you can find good ideas for research. And not only that, you can ask questions to the speakers. You can discuss with them. You can ask for their email address and correspond with them. I'm interested in your topic. Please help me advance in research in this, or maybe a collaboration on that. And discussing with good national and international colleagues. Don't talk. Unfortunately, I mean, good people are gems. You need to identify them, to socialize with them, and to keep contact with them. And that's something important. Public relations, very, very important. So how to find support? First, in your team. If the members of your team are not convinced, forget it. Even if you start the study in your department or in the department where you work, and they are not convinced, the recruitment of patients will be chaotic or will be wrong. You think that you have recruited a bipolar patient. He is not a bipolar patient. He's a patient with obsessive compulsive disorder with something else, or with drugs or whatever. I mean, if people are not convinced, they will not do their best to give you, to follow the best methodology. Write a research protocol. Then forget about it for 2 weeks. Rewrite it again. Forget about it 2 weeks. Rewrite it again. This is exactly what happens with scientific papers. And you will find each time something missing. Version after version. Ask for help from specialists in the field, being national or international. When necessary, adapt linguistically and culturally the inserts. Don't just give you an example. I don't remember which study it was in Casablanca. And we took a shortcut. And we took an instrument that was translated in Egypt. In Egyptian colloquial Arabic. And we tried it. And the answer of the patients was, are you stupid? I mean, or do you think I'm stupid? Why do you talk to me in Egyptian? Like Egyptian movies. And they refused to answer. Now, this is to say, if you have to translate, there is a method for that. Translate, counter-translate, and try it on a group, and have the two languages correspond as much as possible. And when you write your research protocol, do not forget to think already where you want to publish that. Possibilities. I mean, if the result of the study is outstanding, fantastic, then you aim at publishing in a very, very good, high-level journal. If it's medium, so a little bit less. If it is a disaster, then forget about it, or just give it to a small, non-important publication. The first and last names of authors Very important. And this should be known from the beginning. Just tell you a story about an important study we conducted on abnormal movements in never medicated patients with schizophrenia. Because the problem of tardive dyskinesia, just to tell you the story, to make it short, tardive dyskinesia, when it happens in the US, you have courts who have given patients with tardive dyskinesia $2 million in the 1980s. $2 million for one patient. And the question was, do we know of patients with schizophrenia who have abnormal movements who never received an antipsychotic medication? And the answer was yes. And we published that in Psychopharmacology, in the journal Psychopharmacology. And we submitted a protocol, a research protocol, to the NIMH, National Institute of Mental Health in the US. And we received a grant of $500,000. And we had an agreement with our colleagues in the US that the first author will be Moroccan, a lady who was working with me, and they published it with their name first. And this is a very specific thing. I mean, one has to be very careful. I call it safari research. You know, people come in with safari hats and rifle in underdeveloped countries or developing countries. This is what they did. And we could not sue them. We could not do anything about that. So to come back to the main question, is money always necessary? And the answer is no. There are two words in this presentation in red. No, K-N-O-W, and no, N-O. Those research is important to know, and no, you don't need always money. You need paper, pencil, and most of the time it's enough. Sometimes in very difficult situations. I have a dear friend in Lebanon, Eli Karam, who did splendid epidemiological research during civil war in Lebanon and under bombings in Beirut. When he went to the hospital, he could die every day, each day, and he did it. Please keep this in mind when you complain about your conditions in your hospital and your department. This man not only treated patients, taught students, but did excellent research. And I tell you, Eli Karam impacted DSM-5 in its new version. Just to tell you how important this man is in our region. When needed, find sources of financing. Your university, if they have money. And I think that Dr. Fahmi Hussein is in good shape. for that. Probably. Departments of psychiatry in rich countries collaborate. And if you have great ideas, they will finance your research or go along with the research already started with them. In 1980, I created my department in Casablanca in 1979. And in 1980, we started collaborating with WHO, community in biological psychiatry and psychopharmacology. And they dealt with the expenses of many researchers. And this was a network of 17 centers in the world, 17. Mostly developed, but also developing countries. NIMH, if you can. WHO. WHO gave a financing of the National Epidemiological Survey on the prevalence of mental disorders in the general population, examining 6,000 people who were a representative sample of the general population in Morocco. And it was a significant amount of money. Pharmaceutical companies, when it comes to trials on on psychotropic medications, we almost started a phase 1 center in my department or in my university for psychotropic medications. But unfortunately, people didn't understand how important it was to do that, because phase 1 centers in the world, there are not so many. And administratively, it was not accepted. Private sources. Sometimes I go to a bank or I go to a rich person and I had some money for a number of activities, scientific activities or research. Please if you have money, find an accountant to help. I managed money of one study, and I was not the best to do that. And please be transparent towards collaborators concerning financial issues when there is money. In Casablanca, 95% of research was done without financing during 35 years. With financing, when there is financing, half of the income, half of the money goes to the association of patients, systematically. And the other half is for medical doctors and non-medical doctors, members of the team, who are also paid when money is available. I told you about these 2 main studies, but we had the other WHO studies, eye movements in persons with schizophrenia, ALDH, deficiency in mental patients, 2 doses of haloperidol, comparing 2 doses of haloperidol in patients with psychosis, and so on and so forth. I mean, that was quite a learning experience for me and for the team to be part of these WHO collaborating centers in biological psychiatry and psychopharmacology. And we collaborated during 12 years from 1980 to 1992. And we became, in 1992, a WHO collaborating center in mental health. There are not many of them in EMRO region. I think there is one in Iran. There is one in Pakistan and one in Casablanca, and that's it. So type of topics, I told you, psychopharmacology, biological psychiatry, clinical psychiatry, including clinical cases. Give you an example. We all say cultural issues are very important because symptoms, syndromes differ from one country to another, from one region to another, and so on. And one day, I saw a patient who was amazing, young, with schizophrenia, coming from rural areas, illiterate, and having exactly the same delusions as President Schreber, who was described, the case was described by Sigmund Freud. Exactly the same. And President Schreber was president of a court in Germany. He was highly educated. He lived 1 century ago, and so on and so forth. I mean, there were so many differences, culturally speaking, and exactly the same delusion as 2 men being pregnant of millions of people in their belly, and that they were going to give birth to a new humanity. Exactly the same. So when you have extraordinary cases like this, please do your best to publish them because it is helpful and it changes the concepts we have in psychiatry. Social psychiatry, religion and mental health, we published 10 or 12 research studies on that. And people are a little bit afraid. I mean, religion, no, this is just belief and we shouldn't touch that and it is sacred and holy and no. Wrong. We did that and it is extremely helpful. Give you an example. We did a study on circumcision. We found that most of the boys, Muslim boys in Morocco, are circumcised at the age of 3, 4, 5, 6, sometimes 10 years old. And what we found is that following this, we saw 50 boys before, during, and after, and 6 months after. And what we found is that those boys had difficulties sleeping, nightmares, more difficulties sleeping, more nightmares, more difficulties at school, and more phobias. And The funny thing is that when we looked at history, we found that the Prophet Muhammad alayhi salam circumcised Al-Hassan, Al-Hussein, and Al-Hussein at the age of 1 week or 2 weeks, maybe. Very, very, very young. Exactly like the Jews do. And we wanted to understand what the Prophet does, do the same. Why is it different in Morocco? Why do they delay or postpone this? And we found that Imam Malik said, Jews do it that way, we should do it differently. And Morocco follows Imam Malik. And we said, this is terrible. I mean, all the teaching of Imam Malik should be questioned because of this, because this is a religious mistake. And we went to TV, to radio, for 2 or 3 years, we brought the news, the Prophet, what he did, and that the more aged is the boy, the more difficulties of mental health we found. This is to tell you that we should not be afraid of doing research on religion and mental health and culture and mental health. Epidemiology again and again and again. Poor countries, rich research. Find a new concept, find a new idea, a simple one, can be used for your patients in other countries throughout the world and dig your path for years. There is a fantastic example on that. Friendship banks. Zimbabwe, Sub-Saharan Africa. A psychiatrist there found that in rural areas, in villages, when somebody is in very difficult situation mentally, this person goes and sits in this so-called friendship bank. And for people who see these people, they know this person is in need of help. And there are old, wise people who are there to help, who sit nearby or go with him or her somewhere else and talk. And the simple fact to listen in a friendly way to their problems, to their difficulties, improve them tremendously. The funny thing is that in the UK, some schools are doing the same, friendship banks. And in the US as well. And it seems that it functions very, very well. And the senior students, the wiser of them among them, and those who are very empathetic are there to help when there are difficulties and problems. Just to say that you don't need to come from the US or from to have great ideas. A good idea will always find financing if needed, always. The more you publish, the easier it will be for you. It's a snowball effect. And do research and let people know about it. Very important. Go to congresses, present, discuss, talk, like I'm doing. Now, I don't need now to to find money for research, but I can be of help if I'm asked to. I will not be part of the executive, I would say, or the doing the practice, research practice. No, but I can give some advice. To conclude, money is not always necessary. And if you don't find money, do the research you can do. A useful one. If it is just the same stupid question asked and done everywhere in the world and with no impact on your clinical daily life, then forget about it. Idea must be good. Methodology and hypothesis must be good. Methodology must be sound. Implementation must be rigorous. And results must be discussed with the help of a good statistician. Find one, and usually they ask for money. And there is an absolute necessity to show the protocol to a committee of medical research before starting. And many journals will ask you the paper, the signature of the ethics committee in order to publish your paper. So science, conscience, ethical conscience, but also diplomacy in the team and public relations outside the team. This is another information I wanted to give you for those interested. We have in Marrakesh, Morocco, from 15 to 17 January, next one, 2026, the 25th World Congress of Social Psychiatry I organize in my native town, Marrakesh. And the main theme is caring for the vulnerable. I would be delighted to see you attending and discussing, including research in your countries, including research in many other parts of the world, because we will have the best people in social psychiatry attending and contributing to this World Congress. Thank you very much for your attention. And do not hesitate to write to me on this email address.
Thank you so much, dear professors. Thank you so much for your enthusiastic talk and for your encouragement for us, the young researchers. I have several questions for you, but I think the time is limiting our questions. First of all, I want to ask, you mentioned you may collaborate with WHO for research. Really, in the developing countries, especially in Iraq and Iran, we have a problem of high diseases. There's a parasitic infection.
Excuse me, I have a problem hearing you and understanding what you say.
Oh, sorry.
I'm going to increase the level of the microphone, and if you could maybe have your voice a little bit louder, that will help.
I want to change this. Dear Professor, do you hear me right now?
Yes. Please. Go ahead.
We have a problem. One of the points you mentioned is that we can collaborate with the WHO, and you can try to have financial support from WHO for our research. Really, we have a big problem in the developing countries, especially in Iraq and in Iran. We have problem of parasitic infection called hydatid cyst, a special parasitic infection involving the lung and livers. We have done several research. Till now, you couldn't find the source of this infection. How do you recommend, how do you advise us to bring WHO into this field and to help us in finding the source of this endemic infection in this region?
You know, first of all, WHO recognized only one authority in each country, the Minister of Health himself or herself. Nobody else. So we convinced the Minister of Health for the National Epidemiological Survey. And I had excellent relationship with the representative of WHO in Morocco at that time. I told you, public relations, very important.
Okay, just another question. One of the title you mentioned, researchers in your country, usually they don't receive money for themselves as a payment. Do you think it's all the same in the Western country or the developed country that researchers doing research as a free of charge or as a voluntary action?
You know, I spent 5.5 years in Paris in Saint-Anne Hospital for my postgraduate training. And I was involved in research in the Department of Psychiatry led by Pierre Deniker. Deniker is the man who found chlorpromazine in 1952. He was my boss and my mentor and my teacher. And all of the studies conducted at that time were paid for. The people who were involved were paid. But when I came back, I paid my collaborators with enthusiasm and love. And that's it. If you like them, if they like you, if you convince them, then they will do it.
All right.
Otherwise,
yes, thank you. And the point you mentioned, being present in the international conferences will help you to find out good idea, a good relationship. But you know, in the developing countries, another obstacle is getting visa. How to get visa to the Western country, to the developing country, already developed country. How do you advise researchers in this country to overcome this issue? Is that any way?
I know it is very difficult. It is a painful process. I live in Casablanca, and most of the embassies are in Rabat, 80 to 90 kilometers from Casablanca.
Mm-hmm.
And in the 1980s, it happened to me that I needed to obtain 7 different visas in 2 weeks. So you imagine going and coming back from Casablanca to Rabat with all the obstacles and all the burden of teaching and treating patients and this and that. So I know it's painful. Just to let you know, I'm going to a WHO meeting in about 10 days from now in Geneva. And immediately at the end of this month, my Schengen visa will end. And I will have to, and it's difficult and problematic. And because I have contacts with a number of influential people it's a little bit easier for me, but it's painful. And there is nothing else to do than to consider that it's part of your work to do that.
Okay. And the question some people ask, local research usually don't need money while international ones need this money. What's your advice for that? Do international researchers need money always?
I didn't get your question. Please repeat.
Yes. So someone asked if you do a research locally, so you may not need money, while if you do a research which is for international level or an international necessity may need money. And for international research, usually you need money. Do you think it's always the case that international researchers need this money?
But you don't need to spend money yourself. You find it in rich countries, in rich departments.
So
Go to Department of Psychiatry of Harvard or Yale or London or whatever. I mean, and they have the money, and they will not share the money. In bank account, they will pay for you maybe to come to be trained on the topic. They will pay for the Zoom webinars or meetings or whatever. They will pay for the statistician and so on and so forth. But you will be part of something that is already there. Give you an example. The study that was conducted on eye movements in patients with schizophrenia, in people with schizophrenia. It was the leading center was in Tokyo, Japan, and what happened is that they gave us all the instruments to do that. And it was something like $80,000 for each instrument. And they paid for everything. The instrument, to send it to Morocco, we didn't pay customs, fortunately, because it went through the Ministry of Health. But this is how it happened. I don't hear you. No.
Okay. Thank you, dear Professor. Thank you, dear attendees. Thank you for this opportunity, dear Professor, for your time. I hope in future we can see you again, and inshallah, you will have a very great, successful Congress. Thank you so much for your time. Thank you for everyone. This is the end of the webinar, and see you in the next webinar. Thank you so much.
Bye-bye.
Bye-bye.